Here tonight, the growing mental health crisis that's happening across the state of Florida. The Florida Hospital Association says in recent years, there's been a decrease in the number of involuntary beds in Florida. Florida hospitals are now warning about the lack of psychiatric beds specifically, and the lack of mental health workers in this state is even more staggering. Right now in Florida, there is just on average one mental health worker for every 550 patients. And now one local hospital is trying to change that. And tonight, J.J. Burton takes you inside the new unit in Lutz that aims to help dozens of patients at a time.
In America, 1 in 5 adults live with mental illness. That's 57.8 million people to be exact, according to the National Institute of Health. Doctors here at St. Joseph's North say many of those people also have medical conditions like COPD, high blood pressure, etc.
Right now in our emergency rooms,
This is interim president Sara Dodds.
we have patients with medical needs and psychiatric needs, and we delay treatment because there's nowhere for them to go.
And the doctors here believe they found the solution. And it's here inside the hospital's new unit for psychiatric medical services, also called UPM, and the first of its kind in the country.
Let's deal with their mental health issue and their medical issue at the same time. Let's get them better together. So what we've built here, and you'll see, is a sensitivity to someone with mental illness and their medical condition.
The unit will have 24 beds and will be fully staffed with doctors, nurses, and therapists. The director for inpatient services for behavioral health, Anthony Santucci, gave us a tour.
Once our patients are medically cleared within the St. Joe's Hospital North Emergency Department, they come up here to the intake area for continued evaluation and assessment.
Patients will be in rooms like this with first of its kind psychiatric medical beds. Unlike traditional hospital beds, these beds are made specifically so patients can't harm themselves. For example, you will notice there are no holes in the bed rails, so patients can't tie things around them. Also, all of the normal equipment like oxygen tanks are locked behind this wall, which can only be unlocked by staff. The rooms don't even have regular bathroom doors.
And in the spirit of reimagining care delivery, by taking the traditional door away from the space, what you have now is the maintenance of privacy, right? But then what you also have is if you put pressure on the top of this door, it will collapse and it won't allow a ligature point.
All of the rooms are outfitted with Alexa. And if the therapist can't come to the patient, they can get them on the TV. Santucci says they got the idea from the pandemic.
There was a lot of positive things for us to learn from that experience. And that was definitely one of them.
And all patient rooms will be monitored around the clock.
To really push that edge in terms of technology, as well as, a new age of looking at delivering medicine. I mean, that's what we're here for, right? There's a cry and a need from the community, and we're rising to that occasion.
It's officially scheduled to open on April 17th. J.J. Burton, ABC Action News.
Well, one local organization tells us the new facility comes at a critical time. The Central Florida Behavioral Health Network says many hospitals have closed down their mental health units over the past few years. And at the same time, the United States is facing a shortage of 14,000 psychiatrists as well as social workers.
We have a drastic, a really big shortage of clinicians, and that is making it very difficult to open and staff new programs. This year, we were blessed by the legislature. We received more recurring funding into our system of care than we have in probably 30 years. And we had providers that have said, I'm sorry, we're not going to be able to use this money because we don't have the staff to do it.
The Central Florida Behavioral Health Unit is now working to help. They are in constant talks with USF about new ways to attract people and are advocating for physician extenders. Those are people recovering from mental health or substance abuse who can go into emergency rooms and meet with patients who are struggling.